One of the advantages we have in Lubbock and at Texas Tech University and Texas Tech University Health Sciences Center is that we reside together on one campus. This allows our scientists and staff to cross the streets to work together on innovative ways to improve the health of rural living people, and it is our investment in the future of rural health. One of these endeavors that we have jointly engaged in will bring together really fine programs in family studies, addictionology, in understanding the mental health needs and providing a workforce in schools, counselors and psychologists and others like that, and understanding better the ways that we can work together in teams because we have scarcities of those kinds of providers in our region. This also brings together the fundamental basic sciences of how the brain works, especially in mental illness and first episode psychosis, so that we can begin to bring the developments in the laboratory to the bedside and beyond to impact the health of the community. One of the projects that has gained some renown in Texas is a project that works with rural school districts, usually with an enrollment of less than 300. That's about 2/3 of all districts in Texas, that has vacancies in its counselor corps, limited mental health resources, and limited things that can be done to help students who have mental health issues. Our work gives school districts an opportunity to refer those kinds of students for mental health evaluation, interventions, prompt treatment planning, and almost immediate appointment for a differential diagnosis with one of our child and adolescent psychiatrists. From there, we begin the treatment journey that results in healing.
In Lubbock, Texas, we are in a severely underserved area for mental health, critically underserved. And that's in Lubbock, where we have training programs to train mental health practitioners. Once you get 40 miles outside Lubbock, you really face shortages of people who are able to adequately treat the mental health needs of communities. And the mental health needs in communities are significant. There are rising homeless issues, for instance, in rural communities around West Texas. There are issues around drug abuse, substance abuse in terms of opioids, in terms of manufactured drugs. Sex trafficking issues are significant in this area. Yet what we have is a lack of practitioners who are adequately trained to deal with these issues and very little support. The thing that we found, we've done a research project in rural areas around Lubbock, and the thing that we found is that the people who are practicing mental health feel extremely isolated. They have very little support. And so as they're doing their very challenging work on a day-to-day basis, and so compassion fatigue, trauma related to dealing with client issues, they have very little support in order to continue to do their work. And so with that, we have created modules where we present cutting-edge information to these counselors through a community partner. We also do a yearly conference that's low cost and that enables folks to come to the Tech campus. And we've talked to folks about whether or not we need to bring the education to them or whether or not they want to come to us. And many have expressed that they want to come to the Tech campus to gather with other counselors so that they can not only gather the information that we're sharing, but also have, so to speak, fellowship with other counselors and professionals.
I'm faculty in the Department of Community, Family, and Addiction Sciences, and one of the main research projects that we're working on is a collaboration between the University Medical Center Pediatric Trauma Center and our department, as well as the psychology department.
What we are beginning to understand and learn is that many patients come because of a car accident, because of a dog bite, because of another physical trauma that they've experienced. They check into the hospital They receive the treatment that they need, but then upon release, specifically those in rural communities, they're released and are still experiencing symptoms of post-traumatic stress or other mental health concerns. And because they live in a rural community that has difficulty of accessing support, mental health support, medical care, is that it's difficult for them to be able to come back and receive treatment for not only just follow-up care for their physical health, but then also their emotional and mental well-being.
And so we are working on a research project that is utilizing a unique approach called community-based participatory research. And the community-based participatory research protocol involves gathering a community of stakeholders, not just the researchers themselves, but the medical faculty, the medical staff, nurses, doctors, nurse practitioners, as well as patients and family members who are involved with the Pediatric Trauma Center.
And what we are doing is we are not only partnering with them to be able to better understand how we can better serve them and provide interventions that work in reducing post-traumatic stress symptoms and other mental health concerns, but then also is working with them that how we can better implement them into the interventions that we offer so that it is a community, a collaboration that will better reduce concerns that they're encountering, as well as just provide a better environment for them to heal in.
So part of our research project is to develop the treatment protocol to help these families, but of course they're not in Lubbock once they're discharged from the hospital. So a main component of our research is using telemental health services to provide the treatment that they need and do the follow-up care that they might need.